Hello friends, hello colleagues.
Hello our friends, hello our colleagues. We are very happy to start a new project.
Today we have a talking.
It is the first talking in our long series, we hope, about doctors talking about beauty and health. Let's introduce yourself, doctor.
I'm Dr. Elena Barinova.
I'm Dr. Victor Gabriel Kletic. We are both dermatologists and we will start a new project. Please, doctor.
Today we have important discussion about dangers on vacation.
Yes, it's an important discussion because usually people don't think that it could be associated something pleasant like vacation with something unpleasant like a danger.
Of course, we are talking about the skin.
Of course, we're talking not only about the skin from beauty, we're talking about the skin from health point of view.
What could be dangerous on vacation?
In vacation could be a lot of dangers. And before we're going to the next step, we will stop to focus on one very interesting slide published a few years ago about exposomes. These pictures is from an article published in 2017 about exposome factors. And we could see here few factors which interfere with our health and beauty. Please, Dr. Barinova.
The sun radiation. Oh, this is the most important.
Yes, it is the most important because a lot of science showed us at least 80 to 90% of our skin aging are connected with sun. And here I want to show something another. We have here ultraviolet, we have here visible light, and we have here infrared. So practical all spectrum of sun radiation could interfere with our health and beauty.
What is the most danger from these waves?
It's separate dangers. Ultraviolet, both A and B, are connected historically with skin aging, with skin cancer. Also visible light. Now we know about visible light. It's associated with melasma. Now about infrared, it's associated with skin aging and with destruction of collagen. So practically each of these subspectrum of sun radiation are associated with negative effects on our health and beauty. But a very important but, we cannot live without sun. We need sun for our life, but we must respect the rules of the sun. And we'll talk after.
Agree. About pollution. What is the pollution? We are going to vacation.
Yes, we are going in vacation, but sometimes we need to stay 3 hours in the blockage. In that moment, all the car around us produce pollution. Or we stay in the car, we have pollution next to us, even if we'll open the window, the pollution going inside us.
Lack of sleep. We need to sleep.
We need to sleep, but usually in vacation we forget to sleep. But what is another thing, even we don't forget to sleep, we change our, rituals of sleep. We don't going to sleep to 10 o'clock or 11 o'clock, we're going to sleep to 1 o'clock or 2 o'clock. And about sleep, beauty sleep exists. It's reality. It's reality.
Stress. I don't understand. What's stress?
Stress. If you go in vacation to the beach and you want a room to view the beach and you don't have the room to view the beach, you are with stress. Yes?
Yes, agree.
Agree? Or you want to have room to the view to the forest and you don't see the forest. It is a stress?
Of course.
It is a stress. Okay. Another thing what is very important, it is temperature. Extreme temperature could destroy our skin, including health and beauty. We must not forget about nutrition. What we do usually in vacation. We drink much more alcohol. We eat much more sugar. And I want to repeat, sugar is like a Trojan horse. Practically, sugar destroys our collagen in two ways, and we'll discuss next when we'll talk about an amazing factory, fibroblasts. And of course, smoking. Smoking accelerates the process of aging. So practically, in vacation, we could have all of these dangers for our skin, beauty, and health.
Dr. Klatic, can these factors destroy fibroblasts?
Yes, and we'll talk after about this.
Now let's talk about fibroblast.
Who is fibroblast?
This is a very important cell in the skin. What
Yes.
produces fibroblast?
This fibroblast is a very important cell in our skin because practically fibroblast is our factory of collagen. Practically, fibroblasts produce for us the most famous hyaluronic acid, the natural hyaluronic acid. And what we talked a few minutes ago about danger of vacation, each of this danger of vacation could interfere with our fibroblasts. And give me 1 minute and I will talk about everything. Agree with me?
Yes.
Perfect.
Waiting.
First, the sun. Sun destroys the collagen, make fragmentation of collagen. But fibroblasts need an elongated, spindled cell morphology in order to work good. If don't have collagen, the shape, the morphology of fibroblasts are changed, and we cannot produce collagen. Practically, it is a perfect storm. Next, smoking. Smoking reduces the blood to the fibroblast. Practically, fibroblasts don't have enough nutrients, don't have enough oxygen, don't have enough amino acids to produce what we want. What it could be next? Sugar. Sugar have two negative effects on fibroblasts. First, high level of glycemia, of sugar in blood, induce the senescence of fibroblasts. And in another hand, sugar go to the collagen and make glycated collagen. What about pollution? Pollution interferes directly with the fibroblast. Also, stress. Stress reduces the blood. Again, we have impact on this amazing cell. So practically, a lot of factors associated normally with vacation have negative effects on the activity on fibroblasts. And I am sure that you noticed about your patient after vacation what happened with the face and the other skin. Please say us a few words about this.
Of course, the patients came back to me after vacation with dry skin, with different wrinkles, and of course with pigmentation.
Yes, and this is all connected with vacation. And now we will talk about what we could do for this.
So, what we have to do when the patient can come to doctor, and for what?
Here we have 3 specific topics. First, the emergency. Second, when we go to the doctor if we don't have sunburn. And 3, when we go to the doctor if we had sunburn. Let's start with the first. What are the emergencies? First, the emergencies are associated with sunburn. If you go to the sun and your skin become red, if your skin become inflamed, if you have itch, if you have pain, if you have headache, like insolation, you must go very fast to the doctor.
So this is about patients who are like the lobster.
Like a lobster, yes, like a lobster. But what is very important to understand that sun protection means not to use sun cream and stay much more in the sun.
A lot of patients don't care about this, but after they have a lot of problems.
Agree with you, doctor. And another thing it is, we have some important rules for photoprotection. First, put your sunscreen before you go to the sun. 15 to 30 minutes.
And how often?
Usually, at each 2 hours, you need to reapply the sunscreen, or if you go to swim, or if you go to have a volley beach party.
So the patient need to have this cream
On the
back.
On the back, always. This is the most important anti-wrinkle cream. Sunscreen, it is the most important anti-wrinkle cream.
Okay, and if the patient didn't do like this and looking good?
If they're looking good, they need to come to the doctor for another emergency. Look, if they have moles and these moles grow or have itch or start to bleed, to see the blood, in this situation, they must go as soon as possible for this, because sun are associated with induced skin cancer, and we must not forget about this.
Agree. But if the patient has only dry skin?
For the dry skin, we need to attack this from two different points. First, we need to put specific cream, and second, we need to give not only water, because dry skin is associated also with NMF, natural moisturizing factor, and we need this factor, what is produced by our skin, and under the attack of, aggressions associated with vacation, including the function of our skin become lower.
And of course, our patients need to wake up our fibroblasts.
It's a very good word. It's a very good word. How we could wake up fibroblasts? First, call your dermatologist. And after that, you will go to the dermatologist, and I could say what I will do to my patient. First, I will spend 30, maybe 60 minutes to discuss about what happened in the summer. But I will be very, very, very attentive to the details. About smoking, about drinking alcohol, about sugar, about the rituals of sun protection, if had some problems. The next step is to organize what we say a treatment for attack, to remove as soon as possible the negative effects of sun, especially combination of sun, sugar, and smoking, and to start a regeneration program. And I am sure your patient, when come to you after summer vacation, said to you, "Doctor, my Botox doesn't work."
Yes, of course, because the mimic was very active.
Yes, and the mimic is very active for two reasons. First, they don't use specific sunscreen, and the eyes start to do this, and of course in vacation we make joke, we laugh.
Yes, a lot of emotion.
A lot of emotion. We hope good emotion, not only bad emotion, and do like this. And another thing what I recommend to my patient, especially before the vacation, and especially for the patient with acne, rosacea, and melasma, please pay attention to your skin, because it's possible after a summer vacation, melasma, explode. It's possible after a summer vacation, the acne have a flare up, and we need to start as soon as possible, better yesterday, to reduce the negative impact of vacation. Could I say a secret to our friends and our followers?
Yes, I want to know.
The secret is next. In few days, we will put what means skin, summer, sand, sun, beauty and health. As we will focus about anti-aging program after the summer vacation. Thank you, Dr. Barinova.
Thank you.